Good morning, everybody. Before proceeding with my presentation, I want to clear two things. First, I want to thank eIndia allowing me for this presentation at the very last second. And second, this is not say commercial presentation, or I am not promoting any product. It's just an idea, and I want to have your precious feedback on that, how really it's going to work or not. Okay, I'm a medical, now I can introduce myself. Actually, as I introduced, I'm a medical doctor. Right now I am doing my research at National Yang Ming University in Taiwan. So let's come back to the objectives of my presentation. I will be addressing the current problems with paper medical records. And then I will be proposing a solution which I named as personal electronic health diary, and what is necessity in our present healthcare system, and its contribution towards empowerment, efficient healthcare, and encouraging patients to be more involved in their own healthcare management. And at last, I will be giving an idea how I am thinking how it can be adopted in mainstream healthcare system. So let's start with the problem. Here, as you know, we are having three-tier hierarchy in Indian healthcare system, starting from periphery healthcare, then going to district, and then going to tertiary healthcare. The thing is that interesting thing, patients visit different healthcare providers whenever they need healthcare. The thing is that they never visit, I can't say never, at least more often they don't visit the same hospital twice. So I don't feel what is fun of investing lot of amount and having a server and storing the patient's data in hospital when he's not going to visit second time. Next, patient provide insufficient medical history, and I am sure very much that many doctors here will agree with me. Patient just come and say, I got operation in my stomach. They don't know exactly what happened, what doctor did, and what was the outcome out of it. Next, interesting is that hospitals create new medical records for the same patient's revisit. This is more interesting because once the patient is discharged, all files will be sent to archive, and again it depends on status of the hospital. Obviously some big hospitals store medical records, but many small, especially I am talking about small hospitals, which they don't care what happened to the patient. They will be just interested in the new patients, and they will be creating the new medical history for them. And this gives a lack of consistent care and record updates. And there will be no communication among different health providers when patient transfers or refers from one center to another center. Yeah, there are more problems. Physicians are in need of previous medical history of the patient, and moreover, if patient provides some sort of medical history, the problem is illegible handwriting of the doctors and incomplete and diminished information on paper record, even if the patient provides. For example, if you talk about ECG, after a few days, you can't see anything. And next, patient unaware of their own medical problems. Patient unable to recall the medication they might be taking currently, and this is very much common. Just they will call you red tablet or white tablet, doctor, I am using right or red tablet or white tablet. So this is the problem. More elderly people with chronic diseases, having 2 to 3 diseases, they will be having lot of medication to take pre-meal or post-meal. So I don't know how they are going to cope up with all these things. So this lady asked, do you want me to remember my medical history, or do you want me to recall all my current medication? So now here is the solution. So we should have something by which we can get information of a patient. The thing which I want to propose is this thing. It is a mobile, patient-centric medical record that provides organized summary of medical information useful to healthcare providers. Then it is multifunctional and multipurpose. It includes text, images, sounds and other multimedia content. And it is not only supports patients, physicians and hospitals, but also government entities and research institutes. So obviously I will be talking about how I will be doing it in phase manner. Just I want to give a backup that it will be following all standardization, or in fact I should say we should do something which should have international standardization, and there should be a chronic disease management which we are talking about, and data protection, that is security and privacy of the patient should be given utmost importance, and user-friendly software to consider infrastructure where we are going to use this sort of health record or And this is most important slide, and it talks about flow of information. Just talking saying, oh, I want my medical record and mobile is not a smart thing. Anybody can say yes, I want. But the important role comes how you manage the flow of information, to whom you give how much authentication to see the information. So these are the different stakeholders here, and obviously with the lack of time I can't go in depth. Just anybody who are interested can contact me and we can discuss in detail. Now I want to talk about efficiency, that is doctor gains immediate access to medical record and potential to reduce human errors. In last few days we were talking about lot of problems and many causes why we are lacking behind in healthcare, why ICT is lacking behind healthcare. So out of point, just I want to say one thing, that actually technology is not a problem. The problem is when we are integrating different systems, because hospital cannot run with one system. There will be different systems. By adopting electronic record or ICT, we are want each department to work together, and there is lot of transparency. We can watch what other department is doing. So this is where complexity comes. People don't want them to be transparent. They don't want how others to know how much I have worked today or what I am doing. That is the main problem. That's why they find many sort of reasons to avoid all these things. So useful to store and retrieve emergency casualty essential medical data like blood groups, chronic diseases, allergies and so on. I'm saying this because there is lot of discussion even in developing countries and even in developed countries where they are having very well electronic medical record system. Still they don't have any legal rule or legalization of sharing the information. But as a medical doctor, I think we have a right to have accessibility to emergency data, at least essential data like blood group, chronic disease, allergies and medication which we are using. Nobody can stop us to have that. And one more advantage is that we can integrate this sort of PhD with hospital EMRs. A nurse also can review and see in detail what investigations was done and what was the result, what previous treatment was given to the patient. So database where PhD records are stored can use as a good resource for government bodies for disease surveillance, and they can take public health initiatives in advance. And by having this sort of medical record, we can take a second opinion just by sending record to the supervisor or professors. And it also saves time and money for the patient as well as for other stakeholders, because everything goes on time and it takes little time. That means we are saving a lot of money. So how it empowers? Because what many this research has proven that once we give awareness of your own disease, you will be more interested to know what is happening and how to follow and what to eat, how to live your lifestyle. Oh, okay. So I want to go to the important part, that is how it works. First phase, to develop web-based EHR for each consumer I am talking consumer because I don't want to call patient, because we are talking about health record, not medical record. By health providers, and they can go to the portal and PHR, and it will be protected by the software password. Then during each visit, hospital physician work up from the above URL. Information is stored in fragmented groups and have specific code. For example, MEDI for current list of medication, LR for allergies, URL for address of the consumer PHR. Then come back to the second phase. To register, we have to register single mobile phone, because nowadays people is fashioned to carry 4 or 5 mobile phones. So single mobile phone number will be registered with the PHR. SMS service which will be capable of extracting required order or information should be started. For example, if consumer sends SMS by typing MEDI to XSS, XSS is the number agreed by service provider, list of current medication from the PHR of the consumer will be retrieved. And services which can provide is to take appointment with the healthcare provider to review new results, or to receive new results or review old ones, to receive alerts prior to vaccination date, investigation date, and revisit. Moreover, we can go for advanced services like to receive alert prior to routine medical medications. That is for people, elderly people, and people living old alone. And as well as we can use this as a telemonitoring tool. We can telemonitor RBS, that is random blood sugar, ECG, pedometer, and pulse oximeter. These are, as I told, advanced services which can be telemonitored by mobile phone. And it acts as a gateway to BAN. BAN is Body Area Network. Now, I know in future we are getting lot of gadgets which take our biometric and can transfer to mobile phone from through SMS. It goes to the PHR. So in conclusion, PHR takes the transition from paper to software device, soft and easy, gives more control over their medical records, provides awareness and better understanding of healthcare diseases. Using PhD can empower and encourage patients to be more involved in maintenance of their own health, provide essential data to right person at the right time and at the right price. So this is how it's going to work. Yeah.
Thank you very much, Doctor.
I have to run.
Yeah.